So I'll tell you, when I'm running on my patients, the nurses will use the app to contact me. So if I'm seeing a patient and I get a message from one of the nursing staff, I can see it right away and make a decision to either step out of the room or finish my conversation with the patient and then answer the call. For physicians, I can use it when I'm done seeing a patient to say, hey, this is where we're at with this patient. What would you like to do next? Here's what I'd like to do. And that communication allows us to speak asynchronously without having to find a phone call for both of us to be at. I probably use the physician-to-physician communication the most, and that's when I keep track of different consultants over the course of a patient's stay and then over the course of my entire list. From my perspective, it's easy to track cardiologists, gastroenterologists, or other specialties about a patient's care when we're co-managing that patient. For transitions of care to the outpatient world, I can notify a primary care provider of a patient's impending discharge. What I'm finding is it takes less time to get chores done. So if you have a series of tasks to take care of for a patient, or maybe notifying 3 different physicians, you can do that relatively quickly using the PerfectServe app rather than trying to find the pager system for each individual physician. Census tracking, so if 20 patients are on your list for the group, and then some patients have gone home and others have been added on over the course of the day, you can keep track of who's on your list for the group. So in some cases, the only way to track your patients is within Care Connection or our EMR. The PerfectServe app allows you to communicate with others who may just show up to the hospital the next day or at the end of the day. I think it's an interesting way to communicate with other colleagues, and I think it's one way for our nurses to reach you, and for physicians, it's one way to reach out to each other.